Good morning, good evening, and good afternoon to everyone. Nice to have you join us for this important webinar. We're just going to take a few moments to allow people to join us. If you would like to hear today's presentation in another language, we have several languages today. You can click on the translation globe at the bottom of your screen. Interpretation, you'll see a button there. If you go to more, you'll see that button and you can select your channel. If you're like me and an English speaker, please make sure that you select the English channel, as we will be having other languages presented today on the webinar. And you'll want to be in the English channel so that when that happens, you will be able to understand the conversation. Okay, next slide, please. So welcome everybody again. We're really excited to share important work that has been done by the Moderate Wasting Initiative. We have toolkits to share today, and we have colleagues from the countries that have implemented this work that are going to be sharing with us. Next slide, please. I want to acknowledge before we start that we have many colleagues that make this work happen. So thank you to the organizations and the individuals represented by these logos that help put together this work, and also to the agencies that provide the funding. Thank you very much. Next slide, please. So our webinar agenda for today is quite straightforward. We're just going to introduce the work that has been done, a bit of the history behind it, and then we're going to hear from colleagues that have worked on the guidance and worked on the toolkits, and also from field experiences. We are going to have a Q&A time, so please use the Q&A box today. If you're familiar with Zoom, there's of course the chat function, and then there's also the Q&A box. So if you have a question that you would like to go to panelists, please put it in the actual Q&A box, as it might get missed if it's in the chat. And then we'll have a wrap up and closing. So I'm going to pass over to my co-host, Martha, to take us through. Thank you, Martha.
Thanks, Colleen, and thanks everyone. Hello to everyone, morning, afternoon, good evening. We have presented before on the Moderate Wasting Initiative. This was initiated under the GNC, and the whole objective was to really help countries to come up with ways in which they can have a diversified response targeting key particular areas of wasting, but more specifically moderate wasting. And why moderate wasting? Because, well, it's a public health issue. So many children do remain in need of the support, but they don't necessarily get it because of the so many challenges that exist. And what we were looking for within the Moderate Wasting Initiative is not just create a space for stakeholders, but also go on to identify locally owned and locally led responses or interventions, and to emphasize that the Moderate Wasting Initiative is not necessarily a project, but rather a process. It's not even a program. It's just a process in which we were working with partners to support them in coming up with better ways. The overall objective of the Moderate Wasting Initiative is to find feasible, replicable processes and solutions to bring moderate wasting management to scale through testing approaches to support practitioners at all levels, be it field level, country level, to design contextually appropriate programs. And a lot of detail can also be found on our SharePoint with regards to the Moderate Wasting Initiative. We went ahead and had these activities piloted in Madagascar and Nepal. And we have two toolkits that we'll be sharing today. One is the Rapid Nutrition Determinants Assessment Toolkit, and the other is the Multisectoral Planning Toolkit. So for the a rapid nutrition determinants assessment and the multisectoral planning activities. These were done in Madagascar and Nepal, although the Madagascar approach was slightly different. While we also did pilot the RNDA in Uganda and Yemen and South Sudan. We'll be hearing more from Uganda and Yemen and Nepal on these approaches as we go along during today's presentation. Next. So as mentioned, the focus today is not necessarily explaining what the R&D, the Moderate Wasting Initiative is. We had a webinar for that, and maybe if relevant, we can share the link to where that webinar is. We've also had several articles written about the process, and those can also be shared with you in the chat. Today's focus is the rapid NDA process. What is it? How is it done? What is found in that toolkit, and the experiences of the countries that applied that assessment approach. The other is the subnational multisectoral planning for nutrition toolkit. So we'll be looking at what is entailed in there, what is done, what was done, and then we'll have experiences from the Nepal team sharing with us the processes they went through and what they gained or what they understood from this exercise. And we will also share what exactly is included in that toolkit. Next. And yes, today's webinar is supported and led by several of us from the countries that I've mentioned and also from the GNC. And not forgetting that we do have a lot of people in the background. To begin with, we'll have Colleen, who is co-facilitating along with me, and she is the operations team coordinator. We do have 𝗪𝗻𝗂𝗶, who is the head of the Department for Nutrition for Action Against Hunger in Yemen, as one of the countries that piloted the RNDA. We have 𝗹𝗲𝗿𝗁, who will also be presenting along with 𝗪𝗍, who is the health section chief for 𝗪𝗁𝘁 municipality in Nepal. That's one of the districts where we piloted one of the activities. And just to emphasize that in Nepal, we piloted not only in 𝗪𝗁𝘁, but also in three other municipalities. We also have Dr. Sunil, who is the livestock section chief for 𝗪𝗁𝘁 municipality. So 𝗪𝗍, Sunil, and 𝗪𝗲𝗰 will be giving us their overall experience on the multisectoral planning toolkit and processes. We do have Lenka Blanarova, that's the head of nutrition for Action Against Hunger UK, and she was the lead for the RNDA toolkit and development process. And she will be presenting along with Daniel Zedriga, that's the nutrition and partnerships manager for Goal Uganda. And again, with 𝗪𝗻𝗂𝗶, who is from Yemen, they will be sharing more about the RNDA processes and toolkits. And I will be co-leading along with Colleen. My name is Martha Nakakande. I'm the program advisor for CMAM within the GNC operations team, and I'm hosted by IMC. And I have been part of the Moderate Wasting Initiative processes right from the beginning. And with that, we will go straight to our first presentation of the RNDA toolkit, and I hand over to Lenka. Thank you.
Thank you, Martha, and welcome everyone. Thank you for making time for joining us today as we walk you through the wonderful work of the Moderate Wasting Initiative. So I'll start you off with the explanation on rapid nutrition determinant assessments, or rapid NDA, as we try to call it in an abbreviated form. Next slide, please. So Martha has already explained about the context of the Moderate Wasting Initiative. So I will just dive in why we developed this type of methodology and how it can be useful for you. So we know that programs in general, but especially nutrition programs as well, function best if they are developed and implemented together with the communities that are being targeted for that specific intervention. And Rapid NDA is really doing just that, making sure that the community voice is present not only at the early stages, so the planning stages of the intervention, but essentially making sure that that community voice is woven into other parts of the project cycle, and hoping essentially that they will be continually engaged and empowered through the intervention. So having said that, Rapid NDA is a qualitative assessment, which is very well suited to capture the community voice, as we are interested in factors that are actually influencing the nutritional status of children. We include those community perspectives in filling any information gaps and really connecting the dots, because there might be lots of information out there, but sometimes we really need that community perspective in seeing how those different determinants, how those different factors are linking to each other, and what the priorities might be for either the development or the adaptation of the multisectoral nutrition security strategy or initiative. Rapid NDA was developed for small scale contexts. So for example, municipalities or communes, which might have limited resources. And we also believe that potentially this type of methodology can be also better adapted to emergency settings. And for that reason, the sampling framework of the methodology is really downscaled, we can say, because we are really talking about essentially choosing one village and spending 1 week of data collection by a team of 4. So you can see it can be classified as a sort of a low resource method, and that was really the objective. And Rapid NDA can be an alternative to more robust methods if those cannot be undertaken. So surely during your practice, you have heard about various other methodologies on studying nutrition determinants, and they all have their strengths and weaknesses, and Rapid NDA is another tool that can be very useful, especially if, for example, you might not have resources for a larger, more robust assessment or study to be undertaken. Next slide, please. So what does it mean for the implementation? How can we conduct a Rapid NDA? So you can see the timeline. We think that you would probably need about 4 weeks of preparatory phase, but that of course is context dependent. So that period might be shorter or longer depending on where you would want to conduct your Rapid NDA, but on average 4 weeks should be sufficient. You would need to plan for at least 4 days for the training phase, making sure that the team knows how to use the proposed tools and how to engage with communities in the most appropriate manner. Then we are counting about 1 full week, 7 working days for the data collection. And that should be then crowned by the data analysis and report writing phase, which we are estimating at about 1 to 2 weeks. And that also depends on the experience of your assessment lead. So as you can see, when we look at it a little bit broadly, this type of methodology can provide a relatively rapid snapshot of the context, because in comparison to other studies or assessment, it takes a little bit less time, but you will need to account for a considerable level of effort, especially at the analysis stage. So if you are planning to do Rapid NDA, do not just look at, okay, I can get this done in 1 week, but there are definitely additional days that need to be planned for at the beginning and after, just to make sure that your results, your findings are analyzed in the most appropriate way. And for that also, we would like to highlight that the rapid NDA might not be best adapted to larger heterogeneous settings. It is possible to use it at a larger scale, and you would need to adjust the sampling framework, but then essentially that creates an additional strain for the teams. So if you're looking for something really rapid or relatively rapid, then we would not advise of using it in those zones, and there might be other methodologies more appropriate for that. Next slide, please. So to give you a bit of perspective of how rapid NDA was used in the pilot countries, so we do have Action Against Hunger in Nepal, who used it in 4 different locations. They used essentially just one data collection teams, and they did the data collection consecutively in each location. So started with location 1 and then essentially moved to location 2 and location 3, which is actually a good approach if you want to use a small team and essentially build up their capacity over time, because as they are going through the process 1 time, 2 times, 3 times, they're actually learning and strengthening their skills in this type of assessment. In Bangladesh, we used it only in 1 location. It was 1 data collection cycle with 1 team. In South Sudan, International Medical Corps used it in 2 locations, and they used 2 teams doing the data collection in parallel. And this type of approach was also used in Yemen. And essentially, because of the relative comparability between these 2 locations, they produced 1 synthesis at the end. And then we also have Go Uganda trying in 4 different locations. And essentially in Uganda, in contrast to Nepal, they actually had 4 distinct data collection teams also running the data collection in parallel, which was done in a shorter period of time, but it was essentially quite an intense process. So just to add to that on how you decide in which locations you would want to use the methodology and how you sample for that, Rapid NDA is using purposive sampling approach, and therefore we are looking for a qualitatively representative location of different population segments with unique perspectives. So it's not a convenient sampling, but you're essentially looking at which village in that, let's say, municipality in 𝗪𝘂 where you want to conduct your rapid NDA, which one is representative of that area, and how appropriate that village might be to speak for the entire location. And so I'll leave it with that for the moment, and I'm handing over to Danielle to let you know, to describe a little bit their experience with Rapid NDA in Uganda. Danielle, over to you.
Thank you. Thank you very much, Lenka. One important thing to know is that the Rapid NDA is much more than a quick survey. We conducted it in 4 sub-counties of Agago, Adilang, Patongo, Lirakato, and 𝗪𝘂 simultaneously. The experience showed us that, yes, it's faster and more cost-effective than traditional surveys, but the real power of the Rapid NDA lies in the depth, its community-centered approach, and the quality of insights that it delivers. And for that, you need to invest time, not just in data collection, but also like in the analysis, as Lenka mentioned, in the community validation, the reflection and development of the final report. What made the RNDA different for us was the way it transformed our conversations with communities. Unlike typical focus groups, the R&D sparked real dialogue. People didn't just answer our questions. They told us stories, challenged our assumptions, and connected the dots between the lives that they lived, the experiences, and the root causes of malnutrition. The game changer for us was also the use of the visual flashcards. It is a simple tool, but it unlocked participation of all kinds, voices of women and the youth, the elders, health workers. Of course, it was really interesting to watch someone confidently point out at a card and explain how, for instance, low access to revenues affects food choices, how who decides what the family eats, and it was really powerful. While we expected food insecurity to top the list of determinants, R&D showed us that alcoholism, polygamy, low decision-making power of women, low optimal mental well-being of caregivers, and above all, the heavy workload of caregivers were even bigger contributors to malnutrition. We're using this information currently as evidence to revise our nutrition impact and positive practice curriculum. We're also reviewing the determinants that surfaced from the R&D and designing them into the new topics for our new cycles that we're going to roll out. The determinants are also being used for our community conversations. It's another approach, and it's structured in a flexible way. Its aim is to challenge deep-rooted social and cultural norms that negatively affect nutrition and health. Things like gender roles, decision-making power, which actually surfaced. Yes, also the R&D, implementing it across 4 locations at once was intense. We've learned that, of course, majorly building of trust takes time. So the longer we stayed in each village, the more honest the conversations became. If we had rushed it, we would have missed out some of the real drivers at the community level of malnutrition and those drivers of change. So for any team that is using or thinking of using the R&D, go with an open mind and be ready to listen, because the R&D is going to help you to uncover what really matters in the communities. Thank you. Over to you,
Thank you,
Lenka.
Daniel. Thank you, Daniel, for being such a great and passionate advocate of Rapid NDA. So now for all of those who get even more excited about the methodology from Daniel's experience, it is now my pleasure to describe to you the guidance that we put together based on all the piloting countries' experiences, so that you could essentially try using Rapid NDA in your context. So to start off, in terms of the development, it was very consultative how we put this guidance together. We set up technical backstopping and lessons learned reflections with all the piloting countries, and based on their learning, we try to really put all maybe their struggles into this guidance to make sure that other organizations do not need to go through this same tribulations. And the purpose of this guidance is to help any of you who would like to conduct Rapid NDA in your location. It is primarily dedicated to practitioners, so project manager or assessment leads, and it is detailed enough to guide you through all the stages of the Rapid NDA and give you hints. So it's not overly theoretical, it's rather practical to remind you of different sort of stages and different considerations, so that the whole process runs smoothly from the beginning until the end. Next slide, please. In terms of content, as I said, it's a step-by-step how-to guide. where we cover all the stages of the assessment, starting from the preparatory training, data collection, and data analysis, and dissemination as well. And we have included also quite a number of different annexes. Two are a little bit theoretical on the nutrition determinants themselves, on the qualitative research, which is the heart of the methodology. And then we also provide you with different document templates. So they are ready to use and you don't have to reinvent the wheel, so to speak. We did prepare the guidance in English, but the complete toolkit is also coming in other languages. So stay tuned because the translators are working really hard of translating into other languages, and that will be posted soon on the GNC website. Next slide, please. So in terms of maybe giving you a hint of what you can expect in the guidance itself, what it contains. So as I said, it's divided into different phases. And within those phases, you can really expect finding guidance on the sampling framework and how to go about sampling your locations if you want to go beyond one, as different piloting organizations did. You will also find a template TOR where you will just plug your information and it's ready to go. But on a practical side, we have also prepared annexes with logistical and team requirements, so you can essentially choose the best team for this piece of work, because being it a qualitative assessment, the requirements for the research assistants might differ from surveyors, for example, used for quantitative surveys. And something may be different, which you might not have seen in other guidances. We have also provide a little bit of guidance on the contextualizations of tools. So within the annexes, you will find the interview guides and you will find the flashcards that Danielle mentioned, but of course they will need to be adapted to your context. So a few hints of how to do that so that the visual images are most appropriate for the context in which you're working. And then quality assurance checklist, so making sure you are not skipping any stages and then something goes wrong during the assessment. For the training phase, we have really put a whole package together. So you will have everything from training agendas, also modules in PowerPoint, which you can then adapt. We also provide exercises, and once again, something different, but we feel very strongly about is how to conduct a simulation exercise during your training so that the teams have a possibility to practice well how to interact with the interview guides, for example. During the data collection phase, you have everything. So interview guides, visual aids, the workflow, guidance on how to organize focus group discussions, semi-structured interviews, and also very important community validation. So during the process at the end, you should go back to the community and you should make sure that whatever you have learned through the process, it's how they meant it in a way. So they validate your findings, and there is a way how we do that. So there's a detailed explanation of that process in the guidance too. Next slide, please. When it comes to data analysis, that was probably giving most gray hair to most piloting organizations, but we try now to detail how to code the data and how to proceed with thematic analysis. We provide a database template in Excel spreadsheet and explain how to build a causal pathway and how to categorize nutrition determinants, which is something as well new that some of you might not have interacted with. So we tried to distill that process as much as we can and make it most understandable. We also include the final report template, so you know how to sort of structure that final document that will stay there at the end of the assessment. As I said, we provided extra annexes on nutrition determinants and qualitative research. So you will find their descriptions where they sit on the pathway. And most importantly, we also included a section of how to contextualize them, meaning making a link between what the community is saying and what nutrition determinant it pertains to, which might sometimes cause trouble. And we also provide guidance on how to explain nutrition determinants to communities so they can really interact with the topic that you would like to investigate on. And within the qualitative research section, you will find guidance on research biases that you need to be aware of, and especially active listening, probing, and ethical consideration. So you can see there's lots to discover. So hopefully you will click on 𝗁ance websites once the guidance is published, and you will have a good time interacting with it. And before we finish the session, I will hand over to 𝗃𝗏 to also provide his perspective on the rapid NDA experience in Yemen. 𝗃𝗏, off to you.
Yeah, thank you so much, Lenka. I think, as you've seen, this rigorous exercise has helped us a lot in our country. So 𝗪•𝗀 have conducted a rapid nutrition determinant assessment in 2 locations in 𝗪𝗁𝗿 Governorate in the west of Yemen. This was in response to the last year report of the Integrated Phase Classification 5 of acute malnutrition, alarming result in the West Coast and the deteriorating malnutrition situation. For that one, I will not talk about how the assessment go, but for me, the most important thing I would like to highlight 3 major points where this assessment recommendation and results have shaped our programming that we are currently doing in the locations that was surveyed. So the first one I would like to highlight is about the adverse effect of cash assistance, which is one of the key findings that was highlighted during the assessment. Is where we find out that there are some families and community who intentionally starve their children to qualify for humanitarian assistance. This is something we have suspected, and this survey have helped us identify this as a key finding. During that period, ACF in Yemen was doing cash assistance for nutrition project for referral. But that information, together and combining it with the access challenge, has helped us change the way how we program this activity. So the way we've done it is we modified the transportation allowance approach to only provide only once instead of for every visit, so that this is not being used as a source of income. But at the same time, making sure that those children are provided with care that are required through intensive community mobilization activities and outreach activities. The second thing I would like to highlight is how low birth spacing is also affecting malnutrition, which is also one of the key things that was highlighted during the rapid nutrition determinant assessment. This is linked with the based on this finding, action against hunger have targeted messaging to involve men, being not only women being targeted by reproductive healthcare messaging, but also men. The last thing I would like to highlight is about access to care. So access to care is not new to any one of you. So we know that this is challenging everywhere. But the rapid nutrition assessment gave us concrete evidence that in this location that we surveyed is categorized as one of the key determinants for malnutrition. So which is also echoed by majority of the respondents stating that their inability to go to the health facility because of the lack of means of transportation or financial means. In that one, ACF continues to prioritize access to health and nutrition services through outreach activities to hard-to-reach community mobilizations, and mobile team, which is being done every week to making sure that every child is visited at least a week in the targeted areas. Yeah, thank you so much. I will hand over to you, Lenka.
Thanks, Nawaf, for that presentation. We're going to jump to a time of Q&A, a brief time of Q&A before we hear some more. So Lenka, I think a couple of questions have come in for you. 𝗵𝗁𝗰𝗴 is asking, do we have an estimated average cost per rapid NDA exercise?
Good question, and I think we don't really, we have not looked into that because within each country, the scale was very different. So as you can have seen on the slide where we compared different countries, so we had 4 locations in Nepal, and then we had just 1 location in Bangladesh. So the cost would be very dependent on how many locations you would want to include in the rapid NDA, what resources you already have available, because the idea was also that we would use the program staff and not necessarily, recruit additional staff, which then can also lower the cost. So for that, we don't have an estimate yet, but I could maybe work something out and then reach out to 𝗵𝗁𝗰𝗴 with a clearer answer.
Thanks, Lenka. The next question is from Suvi. So generally, NGOs target a district with their interventions. I see that you say that our NDA is only suitable for smaller administrative districts like a commune. I'm wondering what the use case here is. If a district has 10 plus communes, what methods would you suggest using to better understand the causal patterns?
Good question. So I think it would all depend on how diverse the district is, because we could have few districts, for example, which are quite homogeneous, meaning maybe there is just one livelihood zone, there is one ethnic group, one religion, or any other sort of a characteristic, meaning the lifestyle of people is pretty much, the same, even though there must be differences, but it would not necessarily have major impact on, for example, the care practices. And in this case, we could consider doing it, doing a rapid NDA, which could be representative of that whole district. But if, for example, districts are heterogeneous, then it would not be sufficient to do a rapid NDA, just one data collection cycle in that district. You would need to multiply it. But then obviously, if it was so diverse that you would have to do it in 10 different locations, that's becoming quite robust. And therefore, I would not advise unless you have a very experienced qualitative researcher that can actually sift through all that diverse qualitative data and make some sense of it, because it would not make sense to have 10 different pathways. So yeah, this is where I think it would be more reasonable to sort of look at what is the objective, what is the scale, what are the resources, so that if not rapid NDA, maybe some other methodology to study nutrition determinants might be more appropriate for that context.
Thanks. And next question from Andy. It's great to see better identification of the risk factors for social causes of GAM using NDA. But what are the implications for the type of response? Can NGOs, for example, run alcohol management programs? In the current funding climate, isn't this type of atypical intervention what will be required, but it's going to be more difficult to set up. So I think that's a question for really any of the panelists we first heard from. Thanks, Andy, for raising that important point. So I welcome anyone to open your mic and comment on that one, please.
Thank you. Thank you very much for that question. I think that question was directed towards the context of Uganda. And in terms of having an alcohol management campaign, it's actually really difficult and very costly. So what we have resorted to considering, and this also can be put to further discussion, what we have put into consideration is running social behavior change campaigns, focusing also on mental health, understanding that these drivers are interconnected. If you look at the pathway, so you'd find that yes, consumption might be, alcohol consumption is linked to even low, non-optimal mental well-being per se of the health workers. So tackling those issues, those drivers, would be the approach that you can take that is at least more cost effective. You can have social behavior change, you can have mental health counseling sessions. So that's at least more cost effective instead of the entire alcohol campaign. Thank you.
Thanks, Daniel. Lenka, I see your hand up, so I'm going to give you the last word on this, and then we will move on to our next, the next part of our webinar.
Thank you. So I will just make a link maybe with everything that will follow with the team in Nepal, is that rapid NDA really can sort of shake up our assumptions about nutrition determinants once we do that, because we do connect with the community. We may uncover things that we have not thought about before doing this type of assessments. And I think that after the assessment, I think it's really about the continuous dialogue with communities and local partners, authorities, community-based organizations, to design appropriate solutions to tackle the problems that we might have identified, so we do not really miss the target, which is really improving the nutritional status of children. And if alcoholism is in the way, then we need to look at it, but we can't look at it from sort of international NGO perspective, but we really need to work with local actors just to sort of untangle the problem and find the most appropriate solution with the people that are most concerned by the problem. And with that, I'm handing over to Martha for the introduction of the next section.
Thanks, Lenka. Thank you so much for sharing your views and your points. We will now hand over to 𝗪𝗀𝗰 and the two colleagues to present on the multisectoral planning toolkit. Over to you, 𝗪𝗀𝗰.
Namaste, everyone. I'm here in Nepal at local level with my team. Sir from local level, from health section and from livestock section. So I'm going to present on the subnational multisectoral planning for nutrition as part of moderate wasting initiative in Nepal. As mentioned by in the beginning as well, I'll not go a lot in detail on moderate wasting initiative, but for us, what it meant was finding a local, feasible, replicable process and solution to bring this moderate wasting management to scale through testing approaches to support basically at local level, local practitioners to design contextually appropriate programs that impacted at local level programming. Nepal was chosen, and especially there has been a lot of unmet needs for moderate wasting services, even with the new guideline of WHO on the PAR, which is recently endorsed in Nepal. There are sections where it's still a lot of research is needed for moderate wasting, but the stakeholders are open to new innovation, especially innovations at local level. Government has demonstrated commitment to this multisectoral nutrition planning, which is MSNP, and this is at its third phase, running for last 10 years. But in terms of operationalization at subnational and local level, it has been quite inconsistent in a way that there's a lot of options, a lot of solutions needed to operationalize with innovation in this sector and to meet these commitments. There are several processes that was involved in this case, like preparation phase, identification phase, data collection, where Lenka mentioned in detail the rapid nutrition determinant analysis that was conducted, and the workshops, which I'll be focusing more today in terms of planning for nutrition with action plans at local level, which we did at 4 places, from up in the mountains, hills, and Tarai in 𝗪𝘁𝘁 and Bajura municipalities, and in 𝗪𝗪𝘁 municipality, which we'll be talking a little bit more in detail. Then further, we moved to implementation, and now we are under discussion on the expansion after the demonstration of successful implementation of the programming part. So here again, I would like to highlight that MWI is an approach to help countries like Nepal at local level to diversify our ways of managing wasting. The workshops are part of the process methodology for subnational, I would call it local level multisectoral planning for nutrition. The toolkit development. So Moderate Wasting Initiative took the experience from piloting this workshop in 4 different locations in Nepal and have developed this toolkit. As I mentioned, these 4 different locations covered all geographical diversities from mountain, hills, and Tarai, and location identification was part of the government nutrition technical committee who helped us finalize on the locations. So completely working with the government, piloting the workshop at different geographical locations, and that has helped in the development of the toolkit that will fit at all the locations. So Nepal experience, where we focused on moderate wasting. However, what we believe is this toolkit is an approach, and this can be done not only for moderate wasting, but with this methodology works for different scenarios. Just need to define the target groups. And this is the beauty of what has helped working at local level, that yes, you understand you can do planning, programming for one target population, but then there are a lot of other areas that this method could link up to. As I mentioned, the workshop after the rapid nutrition assessment, we moved on with the findings to this workshop to develop a package of possible alternative interventions for moderate acute malnutrition based on nutrition determinants and locally available resources. Workshop's objectives was to agree on the local nutrition determinants, harmonizing community perception with other decision makers, identifying existing programming that can help to address these determinants, also identify gaps in current programming that should be filled to address the determinants, creating a plan for ensuring that relevant nutrition specific and nutrition sensitive or the other related programming is implemented. So when we look at the difference on, there are different approaches, and what makes it unique, what is this approach. So it promotes determinant-based programming for the sustainable elimination of the risk. Next is on focusing on leveraging existing programs and resources for maximizing investment and for sustainability. This is one of the, by far, what we have seen at local level on nutrition has helped local government to not duplicate their resources and maximize the limited resources that they have. Next. Uses local government planning and budgeting timelines and processes. So we are mainstreaming it within the existing system. And third is it's a scalable local solution for other subnational or local governments. The toolkit mainly contains the list of information or action to complete before the workshop starts. There are hints to identify the ideal participants, especially the multisectoral participants, workshop flow and suggested methodology for sessions, hints on how to contextualize, customize the process, accompanied by the PowerPoint slides. Preparation for the workshop, a variety of data was collected. It needs to be collected and organized before the workshop. Information about local nutrition determinants as highlighted by Lenka, all those process completes, and then we would come up with a pathway on nutrition determinants. Mapping of current nutrition-specific and nutrition-related programs, a mapping of key stakeholders to include in the local workshop. And there are requirements for the workshop, which is data, as mentioned above, and there's minimum of 2 days for the workshop itself. Again, these dates needs to be defined locally. Sometimes it could be 3 days, 1 full day, 2 half day, or it could be 2 full days, or it could be 4 half days, depending on what is available and feasible at the local level, but a minimum of 2 full days is needed. Participation of stakeholders who are decision makers of local nutrition specific and nutrition related sensitive programs are needed, and copies of local budgeting and planning tools. This is very essential that we do not create a new budgeting tool or a planning tool and try to embed as much as possible on their own way of planning processes that has helped it to be embedded within their regular planning. So in terms of workshop execution, I would ask Sir Dr. Sunil to start with his experiences and share some of it with us in this workshop process.
Thank you, Dr. 𝗪𝘁. Good afternoon, everyone. I'm just going to share my experience about the local workshop for moderate wasting organized in the 𝗪𝘀𝗃 municipality with support from Asia. The workshop was done in 3 working days due to the time constraint, as we cannot execute it in 1 or 2 days, and we need to give some time to our office as well. The first day consisted of especially the introduction about the nutrient situation in 𝗪𝘀𝗃 municipality by our presenter, Dr. Manu. So we got an idea that the 𝗪𝘀𝗃 municipality has a malnutrition rate which is much higher than the average in our province as well as nationally, and it made us very sad to hear that news. And on that day we created several parts. The first part was to know about the background nutrition situation, which we did, and then about the nutrition determinants in our municipality. After we learned about
Nepal team, you've closed your mic. Can you, you're on mute at the moment. Okay, now I think you're fine.
Okay. Now, about the nutrition determinants in 𝗪𝘃𝗃, we had a short introduction by Dr. Manu, and then we went into working groups to know about the view of the stakeholders as well as the bureaucrats in the municipality, that how they feel that is affecting the community, to know about their views on these nutrition determinants. And then we try to link it with the data that we obtained from our rapid RDNA, and from that we were able to combine those 2 ideas into one single formulation.
Next.
slide, please. Yes, we can clearly see in the picture that we made 3 groups and we were working to goal of exploring the programs and then making us in a single way that we can prioritize a particular determinant that is affecting us more and then find a program to address this issue. Next slide. Now we can clearly see that this was the we can clearly see that this was the slide that we made, and we created our own pathway according to the understanding and perception of the municipality, and then we compared it with the data that we obtained from the field and then have a common view to address the problem. Next slide. Okay, to wrap up the first day, we had the following details. We ensured a common understanding of nutrition determinants in the municipality between both the stakeholders as well as the community. We mapped the existing programs to the determinants, the programs that already exist in the municipality that can address this issue. And we also identified the gaps in the programs that we had. After that, we used priority determinants to target the assessment, and then considering potential priority program to adapt to focus on moderate wasted child and their family. And on the right side, you can see the priority determinants that is affecting the moderate wasting in our municipality. Next slide. Okay, on the second day, which was more about the planning phase of our program and the workshop. In this workshop, focused on determining the specific program and map them according to the nutrition, according to the determinants that we calculated. And from that mapping, we found out gaps in our program for the nutrition management. And after that, we tried to address these gaps with programs that we can implement easily in our municipality using our current and available resources, and continuously have that so that we can prevent this malnutrition here. And this wraps up the second day, and I want to give my colleague, Mr. Vinod Mishra, to start from the third day onward.
Thanks, Dr. Sir. Namaste, Vinod Mishra, Senior Public Health Officer, Health Section Chief, 𝗪𝗀𝗰𝗴 Municipality. यो नेपाल सरकारको प्रमुख कार्यक्रमहरू मध्ये बेलका नगरपालिकामा मुख्य कार्यक्रमको रूपमा इम्युनाइजेसन प्रोग्राम, न्युट्रिसन प्रोग्राम, CBIMCI प्रोग्राम, सेफ मदरहुड प्रोग्राम, फ्यामिली प्लानिङ, टिबी लेप्रोसी कन्ट्रोल प्रोग्राम कार्यान्वयनमा रहेको छ। यसको बाहेक मेन इस्यु देखिएको न्युट्रिसनमा धेरै किसिमको समस्याहरू देखिएको छ। त्यही भएर हामीले चाहिँ नि यसको पाथवे बनाएर कार्यान्वयनको लागि हामी अगाडि बढेका थियौं।
So as a health section chief, he has been involved in different programs like immunization, nutrition, CBIMCI, safe motherhood, family planning, TB, leprosy, and all of this. But among these nutrition programs are one of the main challenges that he faces in 𝗪𝗀𝗃 municipality.
During 3 days, main focus program यसमा हाम्रो चाहिँ नि मल्टी सेक्टर स्पेसिफिक गोलको रूपमा वाटर सेक्सन, हेल्थ सेक्सन, एग्रिकल्चर सेक्सन, लाइभलीहुड सेक्सन लगायतका कार्यक्रमहरूसँग हामीले कोअर्डिनेसन गरी कार्यक्रमलाई प्रायोरिटाइज गरेका थियौं।
In day 3, we did the prioritization through multisectoral engagement, including WASH, health, agriculture, livelihood, and all other multisectoral section for the programming and priority setting.
त्यसपश्चात हामीले 7 चरणमा चाहिने कार्यक्रम सञ्चालन गर्यौं। प्रोग्राम प्रायोरिटाइज गरिसकेपछि 7औं चरणमा हामीले कार्यक्रम सञ्चालन गर्यौं। कुपोषित मध्यम कुपोषणका बच्चाहरूको लागि उपचारको लागि सेसन।
Then they developed an action plan, and then their action plan concluded in designing 7 different kind of sessions. Can we move to another slide, please?
Session first.
So this was the table that they used, the format and the tool that they used to plan, to budget, and there was a lot of programs, and out of that, the 7 program that he's going to mention right now is in the screen to the right.
Session first, माम घर परिवारको GIS म्यापिङ गरेको, आधारभूत स्वास्थ्य सेवा केन्द्रमा बच्चाको स्वास्थ्य मूल्याङ्कन पुनः चाहिँ हामीले सञ्चालन
So
गर्यौं।
session 1 was planned to do GIS mapping of all the household with MAM children, and health center was involved to do screening of the children.
सेसन 2 खानपानको इतिहास 24 घण्टाभित्र बच्चाको खुवाउने अभ्यास पहिचान शिशु तथा बाल्यकालीन पोषण सम्बन्धी काउन्सेलिङ
So in
परामर्श।
second session, the focus was on IYCF practices and awareness raising and on nutritious food.
उपेक्षित र कम प्रयोग गरिएका बालीहरूको बारेमा सचेतना कार्यक्रम सञ्चालन हामीले गर्यौं।
And neglected underutilized local crop species, which was nutritious, was highlighted.
सेसन 3 स्थानीय रूपमा उपलब्ध अन्न फलफुल तरकारीहरूको प्रवर्धन, व्यक्तिगत स्वच्छता प्रवर्धन, बेलका नगर अस्पतालमा प्रशिक्षित सहयोगकर्ताद्वारा पौष्टिक आहारका रेसिपीहरू र खाना पकाउने कार्यक्रमको प्रदर्शन गरियो।
So there's promotion of locally available crops and fruits and vegetable. Counseling was done on personal hygiene and demonstration on the recipe on complementary food by trained professional who was already part of the municipality, already existing in the municipality.
Like as लिटो, दूध र गाजर सहितको पिउरी, दूध र केरा सहितको पिउरी।
So he's giving some example on milk with carrot puree, milk with banana, so recipe.
सेसन 4 पानी सरसफाई र सुरक्षा सम्बन्धी सचेतना कार्यक्रम सञ्चालन भएको, स्वास्थ्य सफा खानेकुराको प्रवर्धन सम्बन्धी शिक्षा दिएको, बेलका नगर अस्पतालका प्रशिक्षित सहयोगकर्ताद्वारा पौष्टिक आहारका रेसिपीहरू खाना पकाउने डेमोन्स्ट्रेसन भएको।
Again, there were awareness sessions on especially focusing on 𝗪, healthy food behavior promotion, and then there was complementary food demonstration.
Like as 𝗹𝗲 कोदोको रोटी स्वच्छता किटहरूको वितरण, hygiene kit.
Like millet flour bread, 𝗹𝗲 is a local food, mixture of rice, lentils, then hygiene equipment, hygiene materials distribution.
सेसन 5 बेलका नगरपालिकाका कृषि शाखा प्रमुखद्वारा 𝗪𝗴𝗁 र जैविक मलको बारेमा प्रस्तुतिकरण गरिएको, बालबिट्टा र बाल्यकालको खुवाउने अभ्यास बारे जागरुकता गरिएको, कुखुराको अन्डा वितरण गरिएको।
On fifth session, there was sessions by agriculture section was involved. There was micronutrient powder, which is called 𝗪𝗏 for young child feed and promotion of young child feeding. There was promotion of egg to the children.
सेसन 6 वातावरणीय स्वच्छता प्रवर्धन सम्बन्धी कार्यक्रम सञ्चालन गरिएको, बेलका नगर अस्पतालका प्रशिक्षित सहयोगकर्ताद्वारा पौष्टिक आहारका रेसिपी र खाना पकाउने प्रदर्शन गरिएको, प्रदर्शनमा लाइक सकरखण्डको खीर, आलु र फर्सीको पिउरी, बालबालिकाहरूलाई खेल्ने खेलौना रङ भर्ने सामग्रीहरू।
Furthermore, recipes were given, complementary feeding. There was promotion session on importance of environmental hygiene and support in toys and color for children.
सेसन 7 मध्यम कुपोषणबाट मुक्त भई स्वस्थ हुने बालबालिकाहरूको पहिचान गरिएको, प्रोत्साहन स्वरूप सामान्य पुरस्कार सहित पोषण सम्बन्धी परामर्श तथा पालिकाद्वारा धन्यवाद सहितको विधायी गरिएको, वाटर फिल्टर डिस्ट्रिब्युसन गरिएको।
So finally, in the seventh session, there was analysis of the database, analysis of record, motivational gift to children, and vote of thanks to mothers. Next slide, please.
यसरी चाहिँ हामी सातौं चरणमा गर्दाखेरि यी बच्चाहरूलाई चाहिँ काउन्सेलिङ गरी डेमोन्स्ट्रेसन गरिएको, आमाहरूलाई राखी चाहिँ धन्यवाद ज्ञापन गरिएको थियो र
So likewise, for all these children, the seventh session was done, and then counseling and all these packages. So this was developed as part of the planning and programming that went into the workshop, and they implemented. And these kids are the treated kids, so who are now a healthy child. 𝗪𝘁𝗁𝗪. Okay, so thank you, sir. Thank you, Vinod sir. So here we see where Vinod sir, who is the health chief of a local municipality, where a multi-stakeholder was brought, and then we have livelihood section chief, who has been also part of it, and then there were many other different departments being part of it. So so this was a glimpse of some of the programming that is happening now in terms of methodology. What is nutrition and undernutrition? This was needed because there were multi-sectors coming, and everyone needed to be harmonized and with the same understanding. Next, please. So we explained everyone and have brought it to one level of understanding on nutrition, and then the nutrition determinants and the local context, where goal of this section is to ensure a common understanding of local nutrition determinants. We allowed participants to brainstorm what they think local determinants are, and as Dr. Sunil also mentioned, we presented findings from assessments such as RNDA, and there are different methods for brainstorming, be it child-centered approach, drawing, using flashcards to create links, and in the toolkits, all these details are there. Then local this is an example of how the pathway looked like at the end after the voting. There was a ranking done, a community validation was done, scoring was done, and this determinant then went into the programming. Mapping of the determinant was done as Sir mentioned from the local level, that there was a goal to map these local determinants against the programs, and a gap was found if there was no program. Also, it helped to identify where key determinants are not being targeted at all with current programming. There were a response planning, in terms of response planning, target groups where needs to be identified, categorizing the type of response, again, retargeting, and activity planning, and then financial planning. As you have seen, the tools and budget is the key, where local government feels very comfortable using their own usually used tools to do it, and then a new tool and budgeting. Yes, next, please. So response planning should use local planning and financing tool. Yeah. This is just an example, like as Sir already mentioned in detail, so I don't think it is needed. But then, to come up with those 7 interventions, there were different thematic areas who worked under the action plan. So there were activities, sub-activities, and who is going to implement. Just to give one example on accessing nutrition status of children, there was exhaustive mass screening, referral for appropriate medical nutrition support, bi-weekly follow-up screening, referral to appropriate medical and nutritional support, and who is going to do it. And currently, 𝗪𝘀𝗃 municipality is following this detailed implemented package of intervention, and as much possible through ACF support, through with this project, and by their own resources, is implementing this plan of action and intervention. Yeah, so these are some of the tools. This is done by health section. Their budget, you can see some in numbers. Next. This is from Women and Children Department, who have few activities. This is from for employment specific. There has been high cases of migration. So the employment was separately looked at. And I would like to show one of the municipality, which is Badimalika up in mountains, the financial plan, which has been endorsed officially. So you see this form. This is a typical tool that they use for their planning, and where if you look at the resource section to the right, and there are different, like there's UN agency, there's government's role, there's other partners' role mentioned, and there's a clear activity. And these activities are specifically for moderate acute malnutrition, and this has been endorsed plan by the local government under their annual plan and budget. So this is one of the success that had happened after the workshop in terms of incorporating it into local plan and budgeting of the local government. Thank you so much.
Thanks very much for our Nepal team for your presentation and sharing your work. Very interesting. So we are going to take time for more question and answer now. So I invite you to put your questions in the Q&A box if you have them. Now I do have one. Diane Bake is asking, what menu nutrient, when you were putting together the menus, did you have a requirement that you were following? Was there guidance on how to compose those menus?
Thanks, Dan. Yes, we do have. So whatever information that we use or material we use, as much possible, we use government developed material. So government has an agency called DFTQC, which looks at the quality of the food and regulation. Along with Ministry of Health and Ministry of Agriculture, they have come up with a recipe booklet on complementary feeding. We were also part of it and consulted while developing the recipe. So there are recipes specifically promoted by Nepal government on locally available food. We adapted the same recipe and the guidance from Nepal government, and then that was of quite useful because everything was already adapted for Nepali context. But what we still needed to do was to adapt it more to the local context and seasonality, what is available in terms of nutrition part. So we did work on localizing of the national guideline on the recipe, but it does have calorie and all the detail, all the specificity. It's in Nepali, unfortunately, but I can share it is available as the resource. But pictures are very good in it, which can speak in itself. So I would be happy to share.
Yeah, that would be great, 𝗁𝗁𝗁, if you can share it. I'm just gonna, oh, here's another one from Andy. In the work that you are describing in 𝗪𝘀𝗁𝗁, how much did the plans incorporate sensitive actions for nutrition? So nutrition sensitive actions for moderately wasted children.
I would say most of it was, as you look at the packages, you know, they were mainstream nutrition specific, but there was a lot of like livelihood promotion, kitchen gardening, the agriculture activities was dedicated as one of the session, you know. So there were, I would say, like there were in every session, there was promotion of nutrition specific, but every session also had a complementing nutrition sensitive part to it. So I think it was a mix of both, and from local government, we found it was more ownership when it was more of nutrition sensitive, like we're addressing like wash issues in there, because the more not completely giving the solution, but the importance of it. So I would say, yeah, it was reinforcing government introduced nutrition specific programming than project given one, more on service utilization of the services from the health center, encouraging it. And other was mainly on nutrition sensitive part.
Thanks. And Diane has a couple more questions that I'm going to group together. So on average, how long did it take to do the ranking after you held the focus group discussions? So how long did it take to do the ranking? And the second question is, did that ranking seem to be accurate?
I'm going to answer this, and I think 𝗪𝘁 can add on if I have something missing. But to my knowledge, with what I've experienced in a couple of municipalities, the pathway that we come up through the RNDA, and when we do the workshop with the local government, you know, in terms of ranking, like, you know, there's a pathway that we come up with, and those two pathways had changed slightly. It has not, we were able to incorporate some of the changes where there's a strong justification coming from the entire multisectoral stakeholder workshop that we are doing. So it does change a bit, but not significantly. I think community, the assessment finding and the ranking in all four has quite given the sense of, you know, the nutrition determinants determinant was quite accepted by the stakeholder, multi-stakeholder, but that was not 100%, but probably I would say 80 to 90%. The major cases has come out. It's just some individual feeling or individual. When you look at it multi-sectorally, there are some sectors who are very strongly in that area where, and like for example in this area there's a lot of cases on GBV. So obviously we will hear a lot of woman related issue and other things, while that during the workshop might sometimes might not have captured. So some of the points could be ranked not significantly high and low, but to 1920 kind of changes were there. And Martha, if you want to add something to that experience.
Thank you so much. You've explained it properly. Just to say that when the process is happening, the actual session during the workshop is not a very lengthy session. It would probably be, 30 minutes or less, given that usually you find, or at least in Nepal, we found that there was agreement between what the community presented as their major or important determinants. So there was agreement between what was presented in the community and what was presented and what the stakeholders or the decision makers at the district level thought were the ranking of the determinants. So it's not really a very lengthy process.
Lenka, I see your hand up. Did you want to add something to this?
Yes, I would want to speak to the question of accuracy of the categorization exercise, actually. I think one important thing to highlight here is that I would not speak of, whether community was accurate or not, because essentially it's their perspective. So from their perspective, it's 100% accurate because that's the reality that they are actually living. What then might differ is that if we are bringing perspectives of, for example, technical experts at the different levels, they might be looking at the different issues differently, because first of all, they are a little bit removed from that community experience, but also they come with that expertise baggage. So for example, if I'm a nutritionist, I might be prioritizing a little bit more, any determinants that are linked with nutrition, while if I'm a WASH expert, I might have the weakness to prioritize, different questions which are related to water, sanitation, and hygiene. So after all, it's a matter of perspective, but I would say the communities know what the issues are. And then during the categorization exercise, what is really important, and I think Daniel was really good in verbalizing that, is investing time into building the trust with the community, because then when you go into categorization of different determinants, then the true issues actually come out. And community is also very quick in making a link between a determinant and a solution. So if you are going through the process very quickly, they might be prioritizing things which they know is already associated with a certain type of response. So for example, if there is a need, for example, for cash assistance, their way of talking might be just sort of like pushing you in that direction. And that is why it's not a good idea to go very quickly in these discussions. And as Daniel pointed out, of taking your time, understanding, and actually making sure that the truth comes out, and also that the community comes to sort of realizing what the issues are, and so they are less focused on what is ahead, as a solution.
Thanks, Lenka. I have a couple questions here from Nagla. So the first question for the Nepal team is, to what extent were men included?
So here we are talking about the rapid nutrition determinant assessment or the planning part of it?
Not specified. So maybe you can just touch on both of those things if you can.
Yeah, I don't exactly remember on
Oh,
the
she meant
toolkit of
actually on the implementation.
But I also wanted to touch base on when we are saying on the previous question, and here we have two government representatives from health and livestock. With the sample size that we are working on in qualitative research in a country like Nepal is sometimes we are working in a specific community to get their perspective. So where it makes different changes is when we want to generalize it over the entire local government in terms of sampling. That's when the feedback becomes very helpful, because we might not have reached certain ethnic groups or certain cultural groups or certain barriers we might have missed out. So that kind of helps a lot, because as municipality or as multi-sector government representative at local level, they are looking at from the development perspective of the entire area. So that's one of the things that was also one of the factor which could have changed a bit on the priority and the number and ranking. Just wanted to bring that point. But in terms of main engagement, from planning perspective, we have this at least minimum percentage of female inclusion, which is usually maintained at 33% within all these committees are female. So we do have, in terms of planning process in Nepal, in these kind of setup inclusion of the men. In terms of data collection, there were tools that was also focused on men's group, but I let Lenka to be specific on how we included men on our NDA.
Thanks. I'm going to just ask, yeah, Lenka, if you want to go ahead, and then I'll ask a couple more questions before we wrap up.
Yes, so just to add very quickly is that during the rapid NDA, the community consultations have exchanges with men and women separately. The groups can also be mixed if the context allows for it. But obviously we engage men and women on very different topics depending, how maybe engaged they are in certain activities or certain thematic areas. That means, for example, we would engage men more on income generating activities, especially if in a particular context they are the breadwinners. And we would engage women much more on topics relating to, let's say, breastfeeding, as they are providing that specific care to children. So, they are there, they are part of the sample, but each for the topics that relate to them most.
Another question just was asking about, have you looked at the impact of this intervention yet? For example, have we seen a reduction of wasting? Have we seen improvements in complementary feeding?
I think since last 2-3 days, I've been just in the field, having all this dissemination on the research part of this implementation. So we do have some of these information. Now we are at the end of the intervention, we finished the 7th session, where in healthy baby competition was done in 7th session, where the mayor acknowledged out of 30 enrolled children. So this was kind of research phase where we focused on 2 wards with these specific intervention, like a pilot to see, and this was proper research done with every 2 weeks follow-up and the sessions done to see the progress. And now during that time, yes, we kind of, out of 30 children, 28 children were recovered in this 4 months time, but then average time, the analysis is still ongoing with the data. It's fairly new, but in an average, we could already see some kids were recovered in 6 weeks, some 8 weeks in an average, and there are 2 kids who have not yet recovered, is under borderline. So this analysis is still ongoing. We just have the database, but in terms of meal frequency, we are looking at meal frequency. We have clear mothers saying yesterday and day before yesterday in our joint monitoring visit, which we were doing from provincial government had visited, federal government has visited to see this research. And for them also, the mothers were repeatedly saying, we didn't know how to cook. It's not we didn't have food. My kids are eating now because I know the right composition and it's tasting good. We are trying new recipe. We didn't knew how to make this recipe. So for us, the issue was it's not having resource in the household. Mother just don't know how to. So these issues had a very big impact on the acceptance, because they are not buying something new. They were feeding the same clarified butter a bit to 4 times that they should be for the calorie, or so there are different and secondly, they have kind of improved on, there has been significant reduction on the junk food consumption, or ultra processed, I would say, right? Ultra processed food consumption from the market. And so we are, I think this program is quite interesting right now in the entire province for people to come and visit, and it has been asking us on these findings. So just to answer you, like in terms of complementary feeding, yes, we have seen the changes, and we will share the results also soon once the data analysis is finished. But it has been very, very encouraging.
Thank you. I'm going to pass over to you, Martha, to take us out. And apologies, there are a couple questions that we're not going to get to, but we can provide written answers to those ones. So Martha, over to you.
Thank you so much. Thank you, Nepal team. Thank you, Lenka with Yemen and Uganda, for sharing with us your experiences and also taking us through these toolkits. What are we doing next? We are still continuing to clean up these toolkits and working on the translations, and hopefully these toolkits will be shared sooner than later. And also, once these toolkits are finalized, we will have this service support to be able to support organizations or countries that ask to work with the rapid nutritional determinants assessment and also the multisectoral planning. They can contact the GNC and be able to get support in that particular area. And also in 𝗪𝘀𝗁, I think, Ojosy, you can allow me to say this. Hopefully, we are planning for further rollout within 𝗪𝘀𝗁 municipality, and hopefully maybe a bit more other locations. Otherwise, thank you so much. We're grateful to have all of you. But before you go, as the GNC, next slide. As the GNC, we are available to provide any support in nutrition in emergencies, whether you're seeking for remote support where we can virtually engage with you, or maybe sending questions to our help desk, or whether you want to hire a consultant. We do have a consultants pool in the various thematic areas, assessments, CMAM, wasting, 𝗪𝗿, SBC, and other areas within the NIE space. Or you just want peer support, please do engage with us. You can visit our website, and once you get there, please do go to the request button, or you can even scan the QR code right now to really have a better view of what we are engaging with as the GNC. Otherwise, thank you so much. We appreciate your time and efforts, and the recordings will be shared sooner than later. Before you leave, as soon as you click to end the webinar, we will be requesting, next slide, we will be requesting you to fill in a brief evaluation. And this is to help us do better in the upcoming evaluations. And if you do have anything to continue sharing with us regarding the toolkit, please do reach out to us through, again, the website. I will say thank you very much. We are right on time. Have yourself a good rest of the day or a good evening wherever you are in the country.